Is a concussion a brain injury?
Yes.
Yes.
Yeah.
It's some form of head trauma.
Yes, definitely.
I would say so, yeah.
Yes, a concussion is a brain injury.
Can you get a concussion without hitting your head?
Probably.
Yes.
Yes.
Of course not, no.
I'd probably say yeah. Like, you could definitely get it in a car crash, like just like the way your head moves.
Yeah, like a whiplash.
Yeah.
For sure.
True. A concussion can be caused by a bump, a blow, or a jolt to the brain, or a blow to the body, or any activity that really causes the brain to move or rotate rapidly within the skull.
Does mild traumatic brain injury mean a mild impact on this person's abilities or a serious impact?
It can have an effect on the person's abilities.
Well, it could be mild, but oftentimes it is serious and people just don't know it.
Probably a mild impact.
It can lead to a serious impact, but I wouldn't say necessarily.
Is that like maybe a serious impact?
In fact, no, it doesn't. A mild traumatic brain injury shouldn't be seen as, say, like a mild winter's day, or thought about like in the same way as a mild winter's day. A mild traumatic brain injury can have long-lasting effects, a long-lasting impact on an individual. It can affect the way that a person thinks, it can affect the way a person feels. Really, a person should be connecting with some professional advice, a medical doctor.
Does wearing a helmet prevent concussion?
Well, I can't say yeah. I can say it can lower it, but it cannot prevent one. Yes, to some extent.
I think it will be help.
Definitely.
It just cushions how hard you're getting hit. It depends how bad the hit was.
Yes.
Helps it, but it doesn't completely prevent it.
Concussions are caused, as I said earlier, by rapid rotation of the brain within the skull, so helmets cannot prevent this. However, wearing a helmet can help to reduce a more serious brain injury, such as a skull fracture or a bleed.
If concussion symptoms go away quickly, is it safe for a person to rejoin the game?
No. Usually should take it easy for a little bit.
No.
I would say just wait as long as your doctor says, sometimes not.
No?
No, I mean, the science is still out on that, and I would say no at this point. Things can reoccur later, and probably be removed from games at that point.
No, and there's a general rule in the game. If in doubt, sit them out.
Is it true that people with concussions shouldn't be allowed to fall asleep?
Yes, somewhat.
Yes, that's true.
Yes.
I know when my boyfriend had one, we were supposed to wake him up every few hours just to make sure that he actually would wake up. Yeah. So a little more dramatic, yeah.
Yeah, I think so.
Yes.
True.
Yeah, that's one of the things you want to keep people awake after concussion, just to make sure that they don't fall asleep and worse things happen.
They're supposed to stay awake in general and be given treatment as soon as possible.
I never really read about it anywhere before, so I don't know.
While it is important to monitor for symptoms, falling asleep is not harmful to a person who has had a concussion. We know that after a concussion, drowsiness and brain and fatigue are common symptoms of concussion, and rest is often recommended. One thing, though, I might add is that parents may be advised, if the child has had a concussion, to wake the child every couple of hours, just to be sure that the child can be awakened easily. But falling asleep is generally not a problem.
Is a brief loss of consciousness necessary to diagnose a concussion?
Yes.
No.
Sure, yeah.
No, I don't agree with that, because it's a concussion. It's not a physical damage that the person can see. The concussion is normally what is happening inside your skull, so...
No.
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 No, and in fact, around 80% of concussions, people do not lose consciousness. Now, there are persistent symptoms that we look out for with concussion, so things like fatigue, nausea, headaches. These are all things to look out for. And a medical professional should be consulted as soon as practical.
Which of the following problems commonly found after brain injury are made worse by alcohol and marijuana? Concentration, memory, balance, or all the above?
I'd say all the above.
I'll just go for all of the above.
All the above. All the above.
Probably all the above, I would guess.
All the above. Balance?
All of them.
Probably all of them again.
I think all the above would.
All of the above. And the thing to remember is that people that have survived a brain injury are often affected much more by these substances than they were before the injury.
Which of the two following are the most common mental health conditions frequently found after brain injury? Schizophrenia, depression, or substance use?
Depression and substance abuse.
Depression and substance use.
Substance abuse and depression.
Depression and substance use.
Depression.
Option A.
Substance use.
Depression is the most common, and substance abuse as well, after brain injury. What we know is that substance use is often a risk factor for getting a traumatic brain injury. And following a brain injury, substance use is often a symptom of poor adjustment.
Wow.